Hey guys, that's the lead follow on the meth deliveries right there on the cycle. Just in case you need to know. It's the blue house on Henry. Yeah, Ben can tell you all about it. Do you guys want some family phone numbers? Is that something that would assist you? I could rattle them off the top of my brain. Family phone numbers for you.
He's an adult, you know, he's come here and terrorized you folks.
Yeah.
So we're going to take him down there. Sergeant looked at any concerns. There's no injuries he's screaming at.
The head injury to the door?
Pardon me?
The head injury to the door?
That's self-inflicted.
Self-inflicted, but because of his...
Let him look at it, but you know what? That's...
Yeah.
He's gotta,
I mean, it'll be a concussion.
He's gotta take due
yeah, he got an MRI recently for the mugging head injury, which I've seen a deterioration after that.
You know, we don't even know this guy. So,
yeah.
And we just...
He was life-flighted with a gushing blood as a 10-year-old. So any head injury is like 100 times more significant because of his original injury.
What I would do, like in a radio call, you can say that this guy's mentally ill, maybe has a 30-year-old man, he's got a 12-year-old capacity, has brain, so that we have a little more information to go on.
Yeah, exactly.
We didn't know that he's going to go from 0 to 100.
He is a DAR, you know, a disability accommodation registry that tries to capture some of that.
We don't know this.
Yeah.
But anyway, he'll be fine. Let the sergeant look at him and...
Can I find out when he's going to be released and whether or not he's going to be back at our door at midnight? Because he will be.
We'll leave you with the restraint order. We'll leave. The jail will probably call you. We'll ask them to call you.
Okay, if he's released. Okay. And he maybe gets conduit into medical?
I don't know. We'll have him.
Who makes that decision? The supervisor? Or?
Nope, the medical people. He didn't, his head did not get banged hard at all.
Yeah.
It just slid. We folded him back.
He was thrashing. I saw him thrashing.
He's thrashing on his own.
Exactly. But he will self-inflict head injuries when he's really out of control.
That's not our problem. I mean, all I can do is get him somewhere. Really. I mean, I don't want him to do that. We've asked him.
Well, I don't want nurses and doctors to get hurt, but I think that's the most appropriate place, and I continue to advocate for that. The jail nurses. Yeah, I'm going to get that information in. Bye, honey. What's that, honey? Yeah, I told him you've been abused. There's going to be a nurse. There's going to be food. They know you've been abused. Yeah. Well, he has been my best friend. Well, Ben, just keep it calm. I'm just trying to give you a pep talk so you... Ben, I'm going to call Kimberly and Christina and Glory. Listen, and my mom's calling the hospital part of the jail so you can get medical treatment. You need to get some electrolytes, some juice, some vitamins, get some food. You have any... No, get some food. Ask for your anxiety medication. It's called hydroxyzine. Practice saying this, Ben. Say hydroxyzine. That's your anxiety meds. You just need your anxiety meds, okay? And everything's going to be great. I will dismiss the order if you get on your medication. I will dismiss the restraining order if you get on your medication. Your hydroxyzine. Ben, everybody has a little anxiety. I'm just telling you. Because you refused medication, I had to get the restraining order. Get hydrox. I'm saying work for yourself. I'm not going to be there to fight for you. You need to fight for yourself, okay? Fight for yourself. Ask for your medication. Ask for hydroxyzine. I'm going to call everybody. I'm going to call them. And I've told them to take you directly to get an MRI. You know you need an MRI. You can't be hit in the head because of your brain injury. Yes. Yeah, and make sure you tell the nurse. I know you're confused. You're confused, honey. It's okay. Ben, it's a beautiful day. Ben, you're gonna get. Ben, it's gonna be okay. Ben, it's gonna be okay. Hydroxyzine. Ask him for it. Ask him. You're gonna be fine once you get stabilized. Hey, Ben, ask for. Okay, listen, Daphne. Ben, remember the redhead who's training the BHU? Ask for her to come visit you. It's Miss Brooks. Is it Dinah or Daphne? I think it's Ben. Listen, practice his name. Stuart Palmer. Listen. Ben, don't throw a temper tantrum. Don't throw a temper tantrum, okay? Ben, you know my uncles are cops. You treat these cops like my uncles. Ben? Well, I know you're low blood sugar. Is there anything we can get you for low blood sugar? Juice or cookies or something? You haven't been... I know. Hey, Ben, and take the time while you're with officers to make a crime report about the mugging at the Hawthorne Bridge. You've been scared of the cops, so you haven't talked to them.
They almost beat me at every inch of my life, and they told me my wrist hurts tired. My head hurts worse than ever. I have the worst headache ever.
They're going to get you some headache meds and Gatorade. Bye-bye. Hi, Mr. Clark. You guys are great. Thanks for your help. Are you going to follow or just talk to me? It's going to be okay. Bye-bye, sweetheart. Ask for hydroxyzine. He needs to be back on his meds. He's got an anxiety med that brings it down.